as an NCLEX question. It is the classic question when we talk about Wilms tumor. The cancer is encapsulated within the kidney. So if the nurse palpates it, that capsule can break open and the cancer will spread all over the body. Oh, absolutely. Sorry, let's do it later, but okay. So,
in the book though, it like says like that's how it's like first noticed by like the parents that they're feeding the kid. But like the nurse.
let's go there with that. What the NCLEX world will say is that this child has like grown around the girth, but not any taller. He's not really fat, but his pants won't fit. He'll complain about the pants being tight. So that's the piece there, yeah. A kid that was on blank, they had just taken him for a healthy visit and something came back on the blood work. So I can't say it's always gonna be diagnosed that way, because the mom said she didn't have any idea. But the big thing about that, and if you put a piece of paper at the head of the bed saying don't palpate it. Okay, talk to me about Hirschsprung. Hirschsprung disease.
When part of the bowel has like neurons or nerves that are there
Missing neurons.
So then poop can't go through, can't have like probably come out.
Yep. Absolutely. So, what is considered a classic symptom of Hirschsprung's? How might it be diagnosed?
They won't have like meconium stool like when they're first born.
They won't poop at birth, they have no meconium. Very good. That could also be true of another disease that we're gonna talk about next. They don't poop at birth. What was the other one, besides that they don't have what they call a patent anus? So pretend like they do have a patent anus, they can poop. There's another condition that's huge that we talk about in the respiratory world. Cystic fibrosis, yep. Again, it's that thick, the mucus for that though. Okay, so the stools are gonna look different. This is the piece, this is a classic piece. Stools are gonna look different.
Steria.
What'd you say? Yes, yes, yep.
For which disease?
We're on Hirschsprung. They're foul smelling. There's still something I'm looking for. Okay, so you have this intestine. You have this part of the intestine that doesn't have any of the nerves. It just gets bigger and bigger and more fecal material and more fecal material and more fecal material. What is it doing to this rectum? It's putting all this pressure on top, so it makes the rectum that, let's say the rectum should be like this, it makes it tiny. So it has to, only tiny little bits of poop can get out, so they'll say ribbon-shaped stools because of how tight that exit is. What's the fix? Surgery, what do?
They remove that part of the bowel and reattach it.
You're gonna take out the part that doesn't have the nerves, reattach it, re-anastomose, big fancy word, and they may have an ostomy, but it will not be permanent. It will just be there long enough to allow the bowel to heal.
Is that the same thing as a bowel resection?
Yes. They'll do a rectal biopsy. That's the definitive diagnosis for Hirschsprung's. The terrible piece, what happens if you get an intestine that won't stretch no more? What's it gonna do? It's gonna break. So you have all that fecal material going into the large sterile cavity, known as our peritoneum, and they die from sepsis. That example would be like a symptom would be like explosive diarrhea after not pooping. Okay. Cystic fibrosis, what can you tell me about cystic fibrosis?
That has the fatty stool, right?
Mm-hmm.
The what?
The Why is it
Stealing.
fatty? Why is it fatty?
They're not digesting
They can't digest any of the fats in the foods that they eat. So they may have a stool that floats. What other kind of presentations? When can it be first diagnosed? The earliest, what's the earliest this is gonna get diagnosed at?
Can't it be diagnosed at birth?
Through the, yes, what do they do? What kind of testing? You do some type of testing at birth,
Oh, newborn screening? Like
newborn screening, the 24-hour newborn screening. What system, what body system, is going to be affected the most? There are all kinds of stuff going on, but what did you see in the hospital? What did they come in with?
Respiratory.
Respiratory infection. They're thick, the mucus that their body produces is so thick, they have a really hard time clearing that. So you get this mucus and it sits there, you're gonna have an infection. So they usually have to come in for that. You think about the vest that the RT will do with them to vibrate them, to knock those secretions loose so that they can cough them up or swallow them. How might it affect their diet-wise? What kind of problems might they run into, or how do we take care of these kids with CF?
I'm thinking like high calorie.
High calories, absolutely. High fat, high calories, and they need to do something else with every single meal.
Take their, pancreatic.
Yes.
enzymes.
Pancreatic enzymes, otherwise they might have just as well taken the food and flushed it down the toilet. They'll get no nutrients. I know, it's pretty extreme. I'm trying to make you guys remember
Well,
stuff,
no,
right?
Yeah.
But they're literally, their body cannot absorb the nutrients unless they have those pancreatic enzymes. Because the pancreatic enzymes come out of the pancreas, right. And what's, it's mucus, right? Mucus is plugging that pancreas, so the enzymes can't get out. Oh, wait, what else can't get out? Insulin. So you may have a type 2 diabetic. Maybe a little bit can get out, but
That would be type 2 diabetic, even though it's not like obesity or like.
if their body is producing some, we know in type 1 there's none.
Right.
Produced. What else? Cystic fibrosis. What else do we need diet-wise? What else are these kids gonna be taking?
vitamins.
Especially the fat-soluble, ADEK, the ADEK. To just try and get as much in them as, a lot of times these kids will end up with feeding tubes, because they just can't get enough calories. Okay. Tonsillectomies, what do you think about when you think about a 2-year-old or an 18-month-old going down for a tonsillectomy?
Actually, I have a question.
Yeah.
So on our ATI, there was a question and it said, like, a lime ice pop, vanilla ice cream,
Chocolate milk.
chocolate milk, or, cherry, whatever. I knew not to
Jello.
give cherry.
Sugar free
because-
jello.
Ice cream, right?
So I was between ice cream or ice pop, but, so I picked ice pop and it was wrong, but like, I don't understand why. Cause I feel like the vanilla ice cream or the lime ice pop could have both been.
Oh, but the ice cream had milk in it, you can't give milk to people.
You don't get, yeah, because the milk would be out, so you're,
But I picked ice pop, but it was wrong.
I feel like you're missing an answer.
The sugar-free jello?
But it was cherry,
But it was
I
red,
can't
it
give
was
cherry.
red jello.
It's 'cause
So I
lime
pulled
is
that out
citrus.
because then you're not supposed to give
And
red
then
jello.
citrus.
So what was the correct answer then? No one knows?
I don't know, but those were literally the 4 answers.
Because your mucus would be out, your mucus producing, your cherry would be out, so it makes me think it would be the lime. I'll look that one up.
But I was very confused.
Lime, to me, when I think of lime, I think of Sprite. And I could absolutely see that being given. I don't know if they're thinking the carbonation. I feel like you guys are missing a right answer, but I don't.
Does
I'll
everyone
see
like
if I can
remember that
find it.
question?
Mhm.
Yeah,
We got
it
two
just
kinda like
didn't
that.
have another good, better answer.
But do you remember missing it? Or is she getting
No,
confused?
I clicked ice pop and I literally missed it, because it was like one of my remediation things, but then in the book, it didn't say anything.
I will follow up on that, because it should be
Yeah.
in your ATI readings. That way you do, so I will take it and look that one up.
Can you give like lime to someone who just got that guy's surgery because like too sour?
I think even the carbonation, I would think would be rough. We want water, we want juice.
It was like, but like, it was like a
Popsicles.
popsicle.
Oh.
It was
Yeah.
a lime ice
Well,
or
that would be,
popsicle.
that would be the right answer, so I'm questioning why you missed it.
Okay.
I'm questioning why you missed it. Let me see if I can find it. I'll delve in looking for it. So we don't want, of course, everything red. Okay, but what are some complications that you might want to be anticipating? Bleeding. And what is the classic, it literally is classic, swallowing,
Swallowing.
frequent swallowing. Like I said, cause they're probably still drowsy from their anesthesia, so that's probably why they would be like that in that state. Do I need to go by systems? It's gonna take me longer if I go by systems than just concepts.
I just went straight down to something.
What is a myringotomy? I'm gonna try and stay in systems. What is a myringotomy? If I'm not saying it correctly, then I'm phonetically saying it.
Is that with the ears? Putting tubes in?
Tubes. Why are kids at a higher risk for getting ear infections?
Cause they are shorter.
What is a known
A shorter what?
eustachian tube? What is a known naughty behavior on the behalf of the parents that can contribute to ear infections?
Packing it in with a Q-tip?
We definitely don't like Q-tips. Cropped bottles are bad. Because how that can end up pooling with their short little eustachian tubes, and then it pools. What's another bad habit that can contribute to ear infections besides cropped bottles? Smoking. Kid needs to be not around that.
So myelin or whatever you said, that's
It's literally like my, M-Y, and then ring, R-I-N-G, O-T-O-N-Y, that is tubes.
There's something else
When can a child get their first influenza vaccine? We have a lot of babies coming down with influenza, COVID, RSV. What would be some education? Kid is running a temperature and we want to give medicine. What can be given, what shouldn't be given for fever?
Tylenol.
Tylenol is a good thing, right? We can give Tylenol. What else can we give? For pain. Over the age of 6 months. Although I've seen it given earlier than that,
Ibuprofen.
ibuprofen. What are we not supposed to give children?
Aspirin.
Giving a child aspirin can cause what?
Rice syndrome.
True or false? Aspirin is in Pepto-Bismol.
What did you say, Chris?
Rise.
What does that mean? You said it.
It's a neurological, it attacks the nervous system. They can die. Seizures. That goes back to the unit we didn't get to with, when can you give aspirin, and that's for Kawasaki's disease. Respiratory. Ooh, how else besides the 24-hour screen, what is the other test that would be ordered if the physician was suspicious that they had cystic fibrosis and the screen missed it? There's another test. Sweat chloride test. If I was to ask you to describe RSV to me, how would you do that? What would you say? Kid has RSV, what's going on?
It's like a cold.
A
Like-
cold,
Adults experience it as just like a mild cold.
a cold on steroids, kind of, sort of. So what do we expect to hear, see?
Rattling chest.
Rattles. Lots of rattling.
Amazing.
Just think about what goes on with a cold. Coughing, sneezing. If the condition continues to be worsened, what would the nurse eventually likely see? Kid just is not, what's causing the problems with the respirations? Getting the air in, getting the air out, what's causing the problem?
Secretions.
Thick cystic fibrosis, thick secretions. So they have a hard time pulling the air through it, they have even a harder time pushing the air back out through this mucus.
So you want a suction?
You're gonna suction, absolutely. You're gonna see elevated respiratory rate. And then what are you going to see? They are still worsening.
Low oxygen saturation.
What are they gonna do? And this is really particular with this RSV. What are they gonna start doing that's gonna give them their low sat rates? What do you say? They're probably too sick to cry or act agitated. They're gonna stop doing something that's gonna make their sats go down. What are they called? It's an episode.
Apnea.
Apneic, yep. So what happens with RSV is they wear out. A baby can compensate, and then they're just done. And so then they start having their apneic spells. What's the treatment once they start having pretty persistent apneic spells?
Oxygen.
It's either gonna be Vapotherm,
Nebulizers.
RAM, nebulizers, absolutely. What comes after the RAM? They're not keeping their sats up on RAM. Intubated. Yep. So think about, when you think about RSV, common cold symptoms, think what those are, and then add on to that apnea. And the apnea comes from they're just worn out. They just can't do it anymore. What are signs and symptoms of an anaphylactic reaction?
Throat swells up.
Throat swells up,
A rash.
absolutely. Hives everywhere. Tightness in the chest, swelling, lips, tongue. What would you do? Let's say you're giving a medication and somebody puts on the call light and you go into the room and the antibiotic's still infusing, there's your patient having an anaphylactic reaction, there's the parent, whatever, or the wife if it's an adult. What are the steps that what's the priority action?
Stop medicine.
Stop the medicine. And then it's gonna be 911. okay, I have an emergency in room 311. No. We don't do that, actually. I accidentally called 911 yesterday. Oh, I hated it. I was messing around with stuff on my treadmill and trying to get my music up. And I'm like, oh my, I am so sorry. I felt so bad.
Did that like sucks when you press this one? Because
Yes.
I think it's always my
It's the
volume
side
one.
thing.
And so I press it like trying to turn up my
Yes,
volume and
that's
then
what
it's
it
like
did.
SOS. And then
It did.
it's horrible.
And then I thought I hit the don't do it, and I didn't. I hit the go do it. I was trying to turn I have like a, a speaker, and I was trying to turn it up on my phone. And God, I'm so sorry. Talk to me about pertussis. How are we protected against pertussis? How do we protect our babies?
Vaccination.
They like mom to get vaccinated, and she's pregnant, some passive immunity, and then they want that baby to get vaccinated. What might, Grandpa, he's not really up on medical terms. What might he call it?
Whooping cough.
Whooping cough. Is that viral or bacterial? Not trying to be tricky. It is bacterial. You get started on an antibiotic for it. Still looking for respiratory stuff here. Talk to me about assessing a respiratory rate in a baby. Is it hard? Is it easy? How long should you count for? That type of stuff.
It is really freaking hard.
It's hard. Because
Watch
they
their
what?
tummy.
Yes.
One of my OB nurses, I don't know, it's, thinking about it now, it's really common sense, but she's like, put your hand on him, and then you can feel him breathe. Because I'm like, I can never hear the difference. She's like, just do, I'm like, why didn't I do this earlier?
Watching the tummy. Yep.
Because you can't
And
do
just
that
like
with
feeling
grown-ups.
it. Yeah, you have to watch them.
So you may very likely need to count that full minute to get the most accurate because their breathing is so erratic and abnormally not regular. Not regular. So it's like, well then how do you, how do you know? How do I know if that breathing rate is okay?
Their oxygen saturation.
Sats are good, their color is good, they're not using their accessory muscles. Okay, well, let's go there. How would I know they're using their accessory muscles?
Contractions.
Contractions. Might do some nasal flaring, some head bobbing. Anybody see because I forgot to talk about head bobbing when we were doing respiratories. It's interesting, you should look at a picture if you don't know what I'm talking about. Literally, kids' head bobs. Oh my goodness. Somebody is having an asthma attack. What's the priority nursing care?
Patent airway.
I'm not sure what hearing you guys as you are too. What did you say, Kimberly?
Maintain a patent airway, right?
Yeah. What is it? But how do I do that? It's going to be priority action for a known asthmatic. Albuterol. Epinephrine's good, but albuterol in the world. I mean, asthmatics very seldom get pens, like EpiPens. Those are safe for your allergies. How does, so that's a beta 2. How does it work? How does albuterol work? It dilates the bronchioles. It says, you know what? Stop it. How do steroids help the airway? Decreases inflammation. Students like to say that it's for constriction. It has nothing to do with constriction. That's your bronchodilator. Your albuterol, or your steroid is your inflammation. intussusception. Intussusception.
It's when like part of the bowel goes, like
Like when you take a sock off inside out, that's what that portion of bowel does. You suppose the kid's screaming, does it hurt? That it does.
Could you explain that in a different way? Like what's
The
going on?
intestines going inside out.
Oh, okay.
And so there's gonna be a rotation like of the valve for it to be able to do that. Sausage-shaped mass. If you read anything about a sausage, it's talking about intussusception. And you can remember that because of all the S's.
Is that like the stool or like the inside?
If you were to do palpation, you would feel, so palpation, you'd feel that
Okay, my
mass.
next question. Not that this like would necessarily matter for a test, but like in general, when we say sausage shaped, are we talking about like a sausage link or like a curvy, you know what I'm
I
saying?
think a link.
Patty?
Yeah, like there's a lot of different sausage styles.
I think it's a sausage link.
Okay.
Good question. Thank you.
What is the classic presentation?
Jelly stools.
Red currant jelly-like stools. It's basically the inside coming out. What's the fix?
Antibiotics.
Not antibiotics.
Surgery.
Could, there's something they're gonna try before that though. Y'all told me about it on a learning check or a video guide.
Air.
An air enema. They blow it back out the other way. How would you know if it fixed itself?
If they have normal stools.
Normal poop. Very good.
Wait, what was it? What was the intervention then? If it's not antibiotics.
They're either gonna try an air enema, essentially, air enema, and if that doesn't work, they'll take him to surgery. So, yeah, it didn't work. They took him to surgery. Got it fixed. This would be the same answer for if a kid went down for pyloric stenosis. The doctor's gonna let the kid eat again. But what are they gonna start with? It's gonna be the best option for a kid who's had GI surgery, like a pyloric stenosis, like to fix the intussusception, clear liquids. If I said to you ORS, would you know what that stood for? I will look that up.
IRS.
Oh, I'm sorry, ORS. My brain was on the next thought here. What does it stand for? And give me an example of it.
Oral rehydration solutions.
So it's oral rehydration solutions. We do this for adults too. Give me an example of one that's most probably commonly used in the pediatric setting. Pedialyte, yep. Nope, no, what'd you say?
Gatorade?
No. They're really careful with Gatorade on peach units because of the sugar content.
What is sugar free?
They would be allowed, absolutely.
Okay. So I think that's what they used to put on.
It's just kind of what's going on, but that is a great place to start. And then if they tolerate that, then they'll advance from that point on. Talk to me about epiglottitis. Medical emergency.
Don't put anything in their mouth.
Nothing in their mouth. What else are they gonna do? What else? What vaccine can prevent it from happening? What's the presentation that the kid's gonna come in with besides respiratory stuff? How is that kid? Drooling? Yeah, yes.
Their throat is like inflamed.
We're not gonna look at their throat, because they come in with the, like this almost triad of things. Drooling is one of them. High temperature is another one, like 102, 103.
Painful and swallowing.
Difficulty swallowing, they might complain of that. But while they're drooling, because they can't swallow, because it's so, you're gonna be in this position. The tripod, so that's kind of if they would come in high temperature, drooling, tripod position, the nurse should think, oh my gosh, this is a medical emergency. They obviously didn't get their hip vaccine, and we're gonna prepare to manage their airway. So the nurse would be thinking about, possibly even a trach kit at bedside. Are they going to get an antibiotic? They are. This is bacterial. Do you remember what the number one cause is? I said it's just naughty. It's naughty in the neonate. Causes problems in the neonatal period. GABHS. Do you remember what that stands for? Strep. GBS.
Is it group A or group B?
I think it's, I don't, you have to know strep. I think it's strep A. Signs and symptoms, the kid has appendicitis. Rebound tenderness in what quadrant of the body? Right, lower. What's the fancy name we call for that area? McBurney's point. How might that kid, she's gonna be complaining of pain. Might do some other things that like, whoa. Yeah, if you ask them to stand up straight, they can't. They'll walk hunched over because it hurts too much for them to stand up. If they get into bed, they'll probably go into the fetal position because that is the position of comfort. What would be a sign that appendix just burst?
I was gonna say.
Hurt more is the opposite of the cancer.
Yeah, no, didn't you say it hurt less?
Yeah, I said it doesn't hurt anymore.
It doesn't hurt anymore.
Yeah.
Okay, yep. That's not gonna last for long because they're gonna start getting sick from the gunk that just went into their peritoneum, into their sterile cavity. What is going on with pyloric stenosis?
It's like a stricture where the food can't pass through the
Cannot.
stomach and the duodenum.
You got it, at the pyloric sphincter. Doesn't happen right away. It usually doesn't. Usually presents itself by week 6. And what are the classic presentations?
Isn't that a sign of cystic fibrosis?
Projectile vomiting.
Projectile vomiting. That narrowing, the food can't get down, but baby has nursed for 20 minutes on both sides or taken 3 ounces of formula, and it just sits there until it builds up, and then the kid's it's gonna shoot across. So projectile vomiting,
They have to decrease that.
they're struggling, they're hungry. They cry because they're hungry because they're throwing everything up. They've lost weight, failure to thrive. What else?
Less stools.
Absolutely. Got the whole weight loss thing. Do you guys remember olive, it's not sausage for this one, an olive shaped mass, about right here, right in the middle of their esophagus, because it will not have, it won't have bile in it, because it hasn't made it that far to be able to get any bile, so it wouldn't be green, no green in it. It's going to be the milk. The other thing they talk about is the peristaltic waves are visible. The body's trying so hard to get that milk to pass on through the digestive system. It's like, nope, not doing it.
So once it gets past the valve, it still struggles.
Once it gets through,
Once it gets through.
it's what's above it that's causing all the problems. What's the fix? Surgery. Usually within hours, they'll start them on oral rehydration fluids. If they tolerate that, they might go to half strength milk. Tolerate that, they'll go to milk. Very fixable.
But, if their symptoms are still present, would you still do surgery?
Surgery is the only fix.
Oh, okay.
There's no medical management as soon as they diagnose, because most of these kids are in distress. Their parents have brought them in because they're below their birth weight. They're not having their wet diapers. They're not gaining their weight. They bring them in, they go, oh, it's pyloric stenosis, they'll do surgery like in 24 hours. Let's just go through. I'm gonna have your brains flip into developmental milestones. 4 months. What do you expect to see, not see? What's that? Head leg needs to be gone. There's something else that's pretty significant at that 4 month that needs to be gone. Sign that their neurological system is maturing. Oh, you're on the right. The Moro reflex should be gone.
Yes.
M-O-R-O. That startle should be gone by 4 months. Those are the 2 big ones. What kind of things are happening at 6 months? Is that
Double your birth weight?
double birth weight?
All over both legs.
They can roll frontwards, they can roll backwards. Oh, one of you gals back there had this answer earlier. Goes on with the fontanelles. When should that back and that posterior fontanelle close by? 2 months. Yep. And then when should the front one close by?
1 year.
They can start teething around that time.
At 6 months?
Yeah. They can try to sit more tripodish. May not be real successful at that yet. They're still they're not super mobile yet.
Is that when you could start giving them like something other than solid foods?
Yes.
Or something other than formula milk?
And what do you want that food to be rich in that you're giving them? We're gonna start with cereal, because that's what we start with. Iron. This is textbook talk. The maternal stores are depleted. So what Babe got from Mom have now been used up. He needs his own. So fortified cereal. I will just flat out tell you that you have to know the order of Erickson stages.
How far do you want us to go with that? Like, you want us to go past adolescence or?
To adolescence. What are the milestones for a 9-month-old?
Crawling.
Yeah, absolutely. Now now we can sit by ourselves. They're gonna be saying all kinds of, mama, dada. Big things there are, the crawling and the sitting on it, unattended. Okay. Cleft lip, cleft palate. What is the known cause and is it preventable?
Iron, like the one that happened.
Anybody wanna help her out? Folic acid, which is not iron. So folic acid, it's a deficit in mom of the folic acid that can cause the neurotube defects. So we didn't go very deep into this. We talked about the cleft lip, cleft palate. What's another big medical condition that is a neurotube defect? We heard of spina bifida. And there's different types of that. We're not, just so you know, that spinal, I can't even say it. Thank you, spinal bifida is a neurotube defect as well as cleft lip, cleft palate. How soon are they gonna close, how soon are they gonna close that lip?
6 to 12 months.
Usually in the first 2 to 3. And do you remember me telling you why they close it at that point? It has more to do with parents accepting of the baby and the bonding is what the textbook is gonna talk about. We also know they can't take a bottle until it's fixed, right? Cause they can't make the suck. Do they make a special bottle for babies with cleft lips?
But I thought that it was better. I guess maybe for breastfeeding.
Breastfeeding's
Okay.
better. The breast tissue just falls in wherever the cleft is at, it just falls in there. Do they have a special bottle for children, babies with lip?
Yes.
They do. And it's, you set them up and you squirt it. And you have to be able to coordinate the squeezing of the bottle with the baby's swallowing. They're going to want to close that, there's a cleft palate by what age? They want that to happen before the kid is really starting to talk a lot.
When did you say?
A year. So, kid went down, had his cleft lip fixed. What nursing interventions, what can you expect to do to take care of this kid? Elbow restraints, absolutely. Very justified elbow restraints. What else? What else you gonna do? Am I gonna put this kid prone? Oh, he's so fussy, put him on his stomach. No prone. Might be a Logan bow. Do you remember talking about that? To keep that suture line intact. There's probably going to be ordered like at least daily, if not every shift, just cleansing of that suture line. Won't be able to go right back to feeds. It'll be a couple days before they'll let him go back to feeds.
Can they just have an NG? Sorry.
What?
Could they just have an NG tube then at that time? Or how would they do that?
IV fluids for sugar. This one was when we were kind of going through stuff pretty fast, but I told you a story about a slipped capital epiphyseal fracture. Slipped capitis femoral fracture. Epiphyseal plate.
Isn't that like the growth plate?
Is the growth plate. trying to mix metaphors on you, aren't I? Yes, here you are. Caitlin knew. That's just a fracture of any bone through the growth plate. So if it's epiphyseal, E-P-I-P-H-Y-S-E-A-L, I'm not used to seeing that word except for when I talk about the slipped capital. Do you remember that one? So that's different than a broken bone through the growth plate. Do you remember the other one? It shared some similarities with leg Perthes disease. Something about that femoral head. What happens? It slips out of place. It's not where it's supposed to be. And what's happening if that femoral head is not where it's supposed to be in that hip socket? What did you say?
Is that like dysplasia?
I want you to think necrosis. If it's not sitting in that hip like it's supposed to, it's not going, its blood supply is going to be interrupted. So they'll take him to surgery. Why don't we, if we're gonna talk about fractures through the growth plate, why are we so worried about that? Why do we care?
Because then those might grow
Pain, disability, gait, yeah, mess up their way of walking. Talk to me about bacterial meningitis. I know a lot of you guys did remediation over that one. Stiff neck. Can't, because of the stiff neck, they can't touch their chin. It's priority nursing interventions.
Seizure precautions.
Absolutely.
They do range of motion.
Priority. So range of motion would not be part of that, because right now their neck hurts really bad. Maintain airway, droplet, antibiotics, you got it. Again, this is for bacterial meningitis. There is such a thing as viral meningitis, usually not as severe, very seldom in the hospital for it. But bacterial, they're going to need to get started on their antibiotics. How long do precautions need to stay in place?
Did they do a spinal tap for that?
They sure can.
What'd you say, Kimberly?
I was asking if they do a spinal tap to diagnose meningitis.
Would be the definitive. What, and I'm talking about precautions, what precautions if the kid has measles? Airborne. There's another childhood illness that if they were to be hospitalized, they would need airborne. What is it? Chickenpox, varicella, TB. I mean, a kid can get TB, so those would be the ones right there. Talk to me about the relationship between like the influenza vaccine and eggs.
If you're allergic to eggs, you can't have the vaccine. Is it if you're allergic to gelatin too?
That's the end of the one.
Okay.
What's the, if you're allergic to neomycin, back to that.
The MMR is really interesting because it can cause thrombocytopenia. Do you remember that big word? Thrombo is platelets and penia is low. So then what risk are they at anytime your platelets are low? Bleeding. Priority nursing action if a kid just ingested his grandma's medicine. Poison control. Remember you guys had that question, but the number. 800. Okay, kids get ear infections all the time, you put drops in them. What's the difference between an adult administration versus a child, and at what age does it change for administering eardrops? Kids, you ready for this? I'm gonna try and see if I can do it backwards successfully. I'm up here at the top. Down and back. What did I just draw? A 2. So, ages 2, what'd you say?
Don't listen to me, I'm sorry.
You know, I misspoke earlier, I get it. So that seems to be like a, what I call a classic question for you guys to see. So at age 2, they think things have grown enough that you can do the back. But you can remember that because it's down and back, and being 2 years of age.
So is that's how you administer the ear
Eardrops, pull the ear down and back. Where on adults, it's just kind of straightening it out. Alright, talk to me about osteomyelitis. Osteo is, how might they present? What might their complaint be? Especially, let's say it's in their leg, which tends to be where osteomyelitis forms in children. Hurts to walk. The parent looks at the leg like there's nothing wrong with the leg. It may not be swollen, no discoloration, it's in the bone. Infections in the bone are really hard to take care of. They're usually on antibiotics for a long time. So that's your priority intervention. Once it's been determined that that's what's going on, they might even go home with IV antibiotics. Have you guys made the association yet? I think we talked about briefly in class with children who have pins in their bone and how important it is to do pin care and watch those pin sites where it goes into the bone for infection, because that's a direct route, right? Right. Why pin care is so important. That can be like a Maslow thing. I think you have one math problem. Okay, well, let's go back to something that Kimberly brought up to us. What might be a sign that the kid, the newborn, has DDH, developmental dysphagia of the hip, dysplasia of the hip. That's CP.
You can't do that, I forget what you call these two.
Yeah.
What do you call those?
I don't know, but the doctor does it.
Yes.
You pull their legs out this way and then pull.
I want you to be able to recognize otolanis,
Oh.
otolanis, and Barlow. You don't have to know which one's which. I want you to be able to recognize that they're assessing the hips. One, they're trying to displace this way, and the other, they're trying to displace this way.
Can you say those words again?
Otolani is OTOLONI, and then Barlow. That doctor's trying to put that hip out of place. Sounds crazy, like why would you do that? Okay. Look,
It does.
yes, yeah, looking at the baby, how might I notice, oh gosh, I wonder if their hip is not where it's supposed to be? Looking at the kid, what signs am I going to see?
Both legs.
One leg is gonna be longer than the other, so they may put that on a question, or it might be that the crack is uneven back here. They're supposed to line up, right? The gluteal fold will be uneven. And how do they fix it? Are you thinking with Pavlik?
Harness.
Harness, Pavlik harness. Hopefully that will work. It goes under the clothes, it needs to go next to the skin, it gets adjusted frequently, so they're gonna be going back and forth to the doctor. If that doesn't work, what might they try? Spica, yes.
There's a question on Instagram, does it go under the diaper?
the spica cast? Which one do you want? The diaper goes,
The diaper goes under,
yes,
yeah.
That's
under
not
the
bad.
harness.
And you,
it's the clothes that it goes under as well.
Wait, so it does go under the diaper?
The diaper would be there and the Pavlik harness is kinda like to the outside of that.
Okay, yeah.
The diaper would be there, there wouldn't be anything over the diaper area, it would just, the straps come down differently. You can look at it quick,
Under diaper or something was one of the answers.
so they can pee on the harness,
Yes, that's what I was like, how would they peel?
they would pee all over the harness.
That's disgusting.
cause
But that-
and you don't mess with it, right? Like it, you don't have to tighten it every once in a while, okay.
And it's supposed to be, they're supposed to be, in it for 24 hours at a time, out long enough to take a bath, have bathing, be bathed and have clothes changed. What is the nurse's role? What is the nurse's role if abuse is suspected? What's your role? Just in general, doesn't have to be on a floor, just you're a nurse, you're a mandatory reporter. What's the number one intervention for SIDS prevention? Back to sleep. They're only supposed to be on their tummy during playtime. I think I mentioned, it's been so long ago, talk to you guys about modeling behaviors when you were when you're working with the baby in the crib in the hospital. Do you remember what I said about that modeling behavior? Nothing goes in the crib with the baby. So if there were like stuffed animals, you take very on the down low, get that stuffed animal perched on the outside of that crib, whatever. So nothing, what about co-bedding? Does it increase or decrease the risk?
Increase.
Increases. I told you guys, went to a funeral of a baby that got smothered. So it really wasn't SIDS, but I think they might have called it SIDS. What about overheating? Increases the risk. What about smoking? Increases risk. How much stuff you guys know? Child's having a seizure. What's your job? What's your number one priority nursing intervention? Get them on their side. What would be right next to that one?
Make sure something that they can hurt themselves.
Move anything that they can, seizure. Should put them on their side.
Don't control the seizure, stop the seizure.
You can go get meds, if meds are ordered. But you're gonna be watching the airway, watching their saturations.
But you wouldn't wanna leave them by themselves, right?
Somebody else is moving your stuff. There'll be no having to know what the different types of seizures are. It's those two big things right there that we talked about.
So question, if it says priority, which one would you do first?
Position.
Position first, and then safety?
Because you're positioning them for their airway, and airway trumps safety, if that makes sense.
That's because they can aspirate, right?
Their tongue can roll back. If they're on their back, their tongue can roll back, so they also say that if you put them on their side, the tongue will go forward. What is the cause of iron deficiency? What can be a cause of iron deficiency anemia in a small child, infant, toddler? Not so much infant, let's go toddler. Let's go toddler now. What can be a cause
Drinking cow's milk?
and how much cow's milk? Too much, too much. They're not eating their iron-rich foods that they should be eating because they're drinking so much milk, they're not hungry for these foods. So So they actually can put themselves into a situation where they have anemia because of that. Okay, you know what, this kid just is running low iron levels. Doctor says, I want you to start your kid on iron. How do you teach the parent to administer that?
I think like a few drops of the iron to the milk or something.
That is wrong, and I'm gonna tell you why, but thank you for participating, I love it when people answer me. What happens if they don't drink all their milk? They don't get it. So really, in the world of craziness, we don't put, for peds, we don't put it into their milk, into a bottle. You could put it into the nipple, and put a little milk in the nipple, and then put that in their mouth. But not so much with iron, because what does iron do?
Stains their teeth.
It stains their teeth. So usually it's not going to be diagnosed, their iron deficiency, until they're in that toddlerhood. When is toddlerhood? Because we got hung up on this question, our first test. Toddler comes after infant, so we're looking at really 12 to 24 months.
12 to 24 is considered toddler.
Kind of, there's no hard and fast about that, but that's the general toddler, the twos. Past infancy, but it kind of depends on the baby too. They know how to suck. They are already drinking mom's Diet Coke out of her McDonald's straw. But that's my family. But they know how to suck. So if they do it that way, the fluid will go past their teeth and they'll just be able to swallow it. So it won't stay in their teeth.
So, how would you administer it?
A straw.
Oh.
They can suck it out of the,
And then if they're little,
using a straw.
you put like the syringe in like the back of their mouth. Make sure you pop the bubble before you put it in their mouth.
I gave mine in the bathtub because it stays closed.
Is that the one you wanna give orange juice with?
It will improve absorption.
They can't take it with antisensitive antibiotics, right?
I don't know that it's contraindicated with anything. It is best taken on an empty stomach for best absorption. Nothing really, I don't know of any interactions with that I know of with the iron. We get on this one, I know, we talked about it a little bit. Kid has scoliosis, bracing didn't work, has to have surgery. What is priority nursing interventions? He's now been rotted, so if he was like all like weird, like, you know, now he's upright like this because he's rotted, nice and straight. Log rolling, huge. What else?
This is after surgery?
This is after surgery.
What, like move too much?
I'm gonna go for priority. Priority. I told you guys it's a huge surgery. I told you guys they go to pick you. Pain. Pain.
Do they need like muscle relaxers or something?
Possibly, but usually it's gonna be pain control. They're going to be miserable. Bleeding is a huge piece as well. A lot of these teens, they will go in ahead of time and they'll donate their own blood so they can get their own blood product back. There's probably gonna be a drain, so we're gonna be watching for bleeding as well. So pain management, bleeding, both of those are great. The bleeding, of course, we control that, but we know they're going to bleed. Just how much are they going to bleed? Oh, I didn't mean to skip this one. Okay, let's go back to meningitis. I'm just gonna flat out tell you, you need to know the difference between Kernig's sign and the Brzezinski's sign. Those are two tests they do for bacterial meningitis.
How do you spell that?
Kerning is K-E-R-N-I-G. And the other one is B-R-U-D. CINSKI. So, with big people, when they're doing a lumbar puncture, for whatever reason, is it meningitis, has the cancer gone to the brain type stuff, they can give directions. But on a baby, you can't tell them to bend a certain way. What is the nurse's responsibility as far as getting that baby into the correct position so the doctor can do a lumbar puncture?
Holding them, like bringing the knees to their chest.
Knees to chest, yep. Review your vaccines again. Go up to, 14. 14. So you have all the stuff at 2, 4, 6, 12, 18 months, kindergarten, and then one more past. Like that preteen, teen, 14, 15-year-old, your age. Questions on anything I talked about? A lot of stuff not on it. To talk about cerebral palsy. Is there anything on, other than what we've talked about already, on that ATI that you want more, you just want more just info on, like a concept that you want to know more about? Those of you who've taken it. Kills me because I can't see it.
I just hate that it doesn't show us the questions again. Like with like the rational, like I get it, because you can't like, whatever, but I don't know.
Like that ICE question after the tonsillectomy, to me, you didn't have any right answers, so I'm missing something there that would help me.
Well, and also like when I was doing like the remediation on it, there was nothing in the book that said anything about it. Like it was telling me what a tonsillectomy was. And then it was just saying no red, like nothing red. So I'm like, it doesn't even tell me I can't do ice cream or the ice pop or whatever.
That was part of your remediation. It would have been in your remediation.
Yeah, I know it wasn't. It was literally just telling me nothing red.
Cause I had that one too. Cause I know that I picked the slime ice pop for that one, and I had
Yeah,
radiation.
give me a second, I'm happy to look for it.
I know, but I clicked ice pop and it was wrong.
Even if we just don't have the answers to the questions, I wish, what questions we had for the questions.
Let me see real quick.
No, I like found it in the remediation because it literally said like what to give someone after the tonsillectomy.
I think you guys would see better. Can you see, can you pull it up on your end? Because you'd be able to get to your remediation again, I would think. So does everybody understand how the points work on that? Do we wanna talk about the points for remediation? You get the points for doing the remediation. And then you can score,
Physiological adaptation.
is it 1 or 2 points more for getting a level 1 or 2, I think.
Okay, so this is literally what it said. Was popsicles, no red because it looks like blood. And so I was like, okay, well I clicked the lime popsicle.
It would be the correct answer. So
So-
something's wrong, because to me, that's the right answer.
Yeah, I think so.
How many hours do we need of remediation? 1 hour.
1
So
hour
it's about
of
saying
concentrated
accessible.
reading. What does it say?
Depending on like your level.
Yeah, I thought I
So-
had 3 somewhere.
Everybody's 1. It's 1 hour.
Okay.
The remediation is going through those different pieces
Because we all have the same test.
on the concepts you missed. There's no reading like there used to be in the old one. It's 1 hour.
Okay, so Bailey and I have a question. So if an adolescent comes in, they're like 14, they're at like a parenthood clinic and they wanna get checked for like STIs, can they give consent or do you have to contact the parent?
For STIs, they can do it without parental consent.
What do we need their parents' consent for, like vaccines or something like that? Like invasive
For like
It's a
pregnancies or
screening.
STIs.
It's a screening as opposed to an intervention.
Could you be prescribed contraceptives without your parents' consent?
I think you can.
Would that be age dependent?
See, I thought you couldn't
it was
do
like a
that.
14
I think you could either.
I think there's an age, and I think it's probably state-wide deal. It's a med.
A 14-year-old or controlled.
They could give them probably condoms.